Hello, welcome back. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here at the Melanin Initiative podcast. I'm back for what I call One Topic at a Time, where we discuss one topic at a time. Today, that topic is how to find a Black dermatologist. If you're not aware, dermatology happens to be one of the least diverse medical specialties. Only 3% of dermatologists are Black, only 4% are Hispanic. The lead organization in dermatology is called the American Association of Dermatology. And about 20 years ago, the now president elect, Dr. Susan Taylor, started a Skin of Color Society. Since then, there have been a lot of initiatives, both in academia as well as in research, to advance education and training when it comes to skin of color. We still have a long ways to go. As you know, I just shared those statistics with you. So I think before I've talked about, actually, no, I haven't talked about it. So today's a great time to talk about it. So we have the different roles in healthcare, as you know. We have the physician, the nurse practitioner, and the physician assistant. And I often get the question, what's the difference? So today, what I want to focus on is why those roles were created. So we have our physicians, and they can specialize in a number of specialties, including primary care. As you know, that's our favorite one here at the Melanin Initiative, because the whole idea of primary care is what we call preventative care. We look at the numbers and we see that if people who fit certain categories based on their age, race, and gender, as well as their lifestyle, fall into particular categories that put them at risk for getting certain diseases. And all of those diseases are associated with money, time away from work, medications, procedures, exams, time away from your family. They can rob you of years that you've earned in retirement. And so we see that, and what we're trying to do is prevent that, because once we do get to those stages, the cost of care becomes much more expensive. So a lot of effort is put into preventative care or primary care. A lot of it is just screening. So a lot of times when you think about primary care, a lot of times people say, I'm not sick, there's nothing wrong, I don't need to see a doctor. But the whole idea is that we want to screen you, develop that relationship, so that when you do get older, when things do start to change, we have a baseline of where you've been. If you have something and it's been there for 20 years and it's never grown, we're going to keep watching it. If one day you start to develop symptoms, it starts to get bigger, then we know, okay, this is something we really need to be concerned about. Whereas if someone else just comes in off the street, I've never seen them before. They have this mask. They tell me that it's been there for 20 years, but I don't know that, or they don't know that. Then all of a sudden we have to order all these tests and do all of these exams to try to figure out what it is, because we don't have a baseline understanding. And I always encourage people to definitely have that baseline before you turn 40, because once you turn 40, you hit a new category of risk. And while before we may have given you leeway, maybe 3 months, 6 months, maybe a year to make changes and make some lifestyle changes to lower your risk, once you hit 40, that ability to give you that much time, it's not the same anymore, because the data shows that once you hit 40, your risk for getting things and the complications associated with that is much greater, and we want to avoid that as much as possible. So a lot of attention, a lot of money goes into primary care. But unfortunately, a lot of physicians have not been choosing primary care as a specialty. And at the same time, we have people living longer. We have more people who are getting insured, so they have access to medical care. And we have made so many advancements in healthcare that people are living longer. And a lot of people are living longer and living with more comorbidities or multiple diseases for a much longer time. So they require people who can take care of them, more providers. And so when you don't have enough physicians going into primary care, there is a demand, and we have a shortage when it comes to those providers. We don't have enough people to take care to meet that need. And so the nurse practitioner and the physician assistant, those roles were created to help meet those gaps in care at primary care. So all of us physicians, nurse practitioners, and physician assistants, all of our initial base training and education is at the primary care level. If you decide you want to specialize in something else, then you go back to school, or you get a certificate, or you do some on-the-job training to earn those skills. So now we come back to dermatology, and just like we have a provider shortage when it comes to primary care, we have a provider shortage when it comes to dermatology. It can take up to 35 days to get an appointment with a dermatologist, and if you live in a rural area, it can take up to 75 days. Unfortunately, we don't have the time to wait for that. It can take up to 12 years for someone to become a dermatologist, and there aren't enough dermatologists to meet the needs of the people. So, the needs when it comes to skin, hair, and nail concerns cannot all fall on the shoulders of dermatologists. And so, we have nurse practitioners and physician assistants here to help meet that need in the population. So, if you've joined us recently, you know we've added a new feature. We put up some graphics, so I'm going to throw those up here now as I talk about the numbers for nurse practitioners. Okay. Okay, so here we have, so these numbers, so it's really easy to find the numbers for dermatologists. So here is a screen that shows the demographics when it comes to ethnicity for nurse practitioners. This is kind of a rough estimate. This particular website, I'll link all the websites today down in the description box. This is really the only one I can find. I've looked for a few months now, and I haven't been able to find any other website or anything in the literature or any surveys that really captures the demographics of nurse practitioners besides this one. I believe it's called Zepia.com. And so this is the only one I have. And it's pretty close to what we see with physicians in terms of um, the ethnicity breakdown. And so still, even at the nurse practitioner and physician assistant level, we see that lack of diversity still exists. So today I'm going to show you some of my favorite websites on how to find a provider. Okay, so we're going to start with my favorite website. This website is a result of a collaboration between 3 companies. The first is Vaseline. I'm sure you're very familiar with Vaseline. Dermatology providers love Vaseline because it helps maintain that skin barrier. Just think of it as you have a picket fence in front of your yard and you put like a plastic tarp around it. Now nothing can get in. That's like Vaseline. It really can protect the skin, lock in that moisture, prevent dry skin, cracked skin, irritated skin. Once the skin becomes dry, cracked, and irritated, now things can come in. Things like infection, acne, psoriasis, rosacea, all those things that we see in dermatology on a daily basis, and that you go to YouTube and to the store to try to treat. So, Vaseline has collaborated with another company called Visual DX. Visual DX helps clinicians improve their diagnostic accuracy, education, and understanding when it comes to treating skin of color. As I mentioned, the lack of diversity in dermatology extends into the resources that we have. So, oftentimes we learn about different diseases, let's say psoriasis, for instance, and we're taught over and over that it's gonna be red. Well, we know that in our skin of color patients, particularly those of us who are in the darker shades, our skin might not turn red. And so what happens is when you go to your provider and they're looking for something to be red, and they don't see it, what happens is we're seeing people get misdiagnosed, diagnosed late, of course, receiving their treatment, delayed treatment, and then sometimes in certain conditions, by the time they do get diagnosed, it's really advanced, and the options that we have to treat it are very limited. And so Visual DX stepped in. They have over 45,000 images of color. And that's been wonderful for those of us who use it in clinical practice to help us improve our diagnostic accuracy. So now they're collaborating with Vaseline so that you can also take a look at those pictures. The third company that's part of this collaboration is called Hued. Hued. Hued was started by a lady named Kimberly Wilson after she had her own experience in healthcare where she felt that had she received culturally competent care, that she would have had better outcomes and she would have had a better patient experience. She did not, and so that inspired her to create Hued, which is a digital platform that aims to improve education and healthcare for communities of color. And so you put the 3 of these together, And they have created a beautiful website, a ton of resources for both patients, consumers, and clinicians. So for patients or even any clinicians, anyone, you can come to this website, which I'll link below. It's called See My Skin. And you can put in, if you know the name, like acne or hyperpigmentation, you can type that in, or you can describe what it is you see on your skin. And it's going to show you a whole bunch of images so that you can get an idea of what's going on. And they have some recommendations in terms of treatment. They help explain what the condition is, how to prevent it, and so on and so forth. For clinicians, they have a catalog of, I think they're up to 5 now, courses on health equity so that people receive culturally competent care, that they understand unconscious bias so that we improve our outcomes when it comes to maternity rates in communities of color. And so once you complete those courses as a clinician, you can get listed on their directory. And that's what we're really talking about today, is how to find a provider that looks like you in dermatology. And so you come here to this website, you can put in your city, and it'll list all the providers of color who have completed those courses. They do have to complete the HUD equity courses to be listed in this directory. But once they do, they'll be listed here. And that just lets you know that the provider that you're going to see has an interest in improving your health outcomes. I love HUD. I actually met with them personally. They were very welcoming to advanced practice providers like nurse practitioners, and they allowed me to take their courses, and they're eager to hear my feedback. I'm going to be writing my feedback on an upcoming blog post on my blog, Mahogany Dermatology. But here, I love to promote this particular screen because it shows one of my Derm MP friends, Ronnie, out there in Chicago. If you happen to be in the area, please hit her up. She has her own practice, and she would love to help you meet your goals when it comes to skin, hair, and nails. All I ask is that you tell her I sent you. And like I said, you can put in any city here. Depending on what city you pick, you might have a plethora of options, and you might only have a few. Here, you can actually see there's only 3 within that 50-mile radius. And that just speaks to what I said, the lack of diversity. And also, this is a fairly new platform, so they're still trying to grow and get their word out. So it's possible that there's just some clinicians that just don't know they exist yet. And hopefully through our platform and by you seeing this video, you'll share it with more people. Here's another very popular one started by a prominent dermatologist. This is called Black Derm Directory. This is the home page. When you go here, you can just click on that where it says Dermatologist Directory, and you'll put in the information that they request, and it will give you a list of dermatology providers near you. And then the next one is blackdoctor.org. So here you can actually look up not just dermatology, but any specialty. Here on the screen, you can see family practice. Family practice is another name for primary care, which is another name for internal medicine or general medicine. Basically, they're just treating you from head to toe. The unique thing about family practice is that they see people of all ages. And so you might have kids go there, and when those kids grow up and they start having kids, they bring their kids there. Maybe their parents go there too. And so you can have a whole few generations of families that go to see the same provider over decades. And a lot of people really like that model. And it makes it really easy and convenient to keep track of family history. But yeah, you can come here to blackdoctor.org, put in the information, and find a provider that interests you. And that's one topic at a time. Today, that topic was how to find a Black dermatologist. And then I sprinkled a little bit of history in there in terms of the diversity in dermatology, some of the initiatives taking place, and some of the things that have already taken place and where we're trying to go with it. Don't forget to tell a friend to tell a friend, and I'll see you next time.